Going to discuss the anastomosis around elbow joint. Elbow joint is a joint which is between the lower end of the humerus and upper end of the radius and ulna. This bone over here, this is the humerus, and this bone is the radius, and this is the ulna. This is the elbow joint of the right side. These are the parts. This is the lower end of the humerus, the anterior aspect of the lower end of humerus. You can see this. This structure is called the medial epicondyle. This structure is called the trochlea, and this is the capitulum, and this is the lateral epicondyle. This is the head of the radius, neck of radius, the tubercle of radius, and then the shaft of radius. This is the upper part of ulna, and this is the shaft of ulna. Now, I will tell you briefly the main arteries which are forming the anastomosis around the elbow joint. One is the brachial artery. The brachial artery is the continuation of axillary artery as it crosses the lower border of teres major muscle. Then it enters the arm, and now this artery, the axillary artery, then is called the brachial artery. So, brachial artery is the continuation of axillary artery. As the brachial artery reaches the neck of the radius, it divides into two branches. One is the radial artery and one is the ulnar artery. I have mentioned their names over here. So the branch on the lateral side is called the radial artery, and branch on the medial side is called the ulnar artery. Now I will tell you about the branches of these arteries, and then I will tell you about the anastomosis which these branches form. The main branch of the brachial artery, the largest branch of the brachial artery, is called the profunda brachii artery. This is the profunda brachii artery. The profunda brachii artery enters the radial groove along with the radial nerve through the lower triangular space. So this, and it moves at the back of the humerus. So this dotted line represents the profunda brachii artery at the back of the humerus. Then it appears on the lateral side of the humerus. So this is the rest of the profunda brachii artery which is appearing on the lateral side of humerus. So this was the first main artery of the main branch of the brachial artery. Then comes the superior ulnar collateral. Superior ulnar collateral is a branch of brachial artery which goes down and reaches the posterior part of the medial epicondyle. So at the back of the medial epicondyle, I have shown it with the dotted green line. So this part is the part of the superior ulnar collateral artery which is lying behind the medial epicondyle. Then comes the inferior ulnar collateral. It is called inferior because it originates inferior to the superior ulnar collateral. So it is called the inferior ulnar collateral artery, and the inferior ulnar collateral artery goes down and comes lie at the anterior part of the medial epicondyle of humerus. Then comes the branches of profunda brachii. Profunda brachii gives off two branches which take part in the anastomosis around the elbow joint. One is the anterior ulnar collateral, which is also called the radial collateral artery. So this artery is the anterior ulnar collateral, or anterior, sorry, this is not called the anterior ulnar collateral, this is called the anterior descending artery, which is also called the radial collateral. So anterior descending or radial collateral branches of the profunda brachii artery. Then comes the posterior descending, which is also called the middle collateral artery. Sorry, this is the posterior descending branch of the profunda brachii, and it goes behind the lateral epicondyle. The anterior descending goes anterior to the lateral epicondyle, and the posterior descending or the middle collateral goes behind the lateral epicondyle. Then we will see the branches of the radial and ulnar arteries. Ulnar arteries gives off three branches around the elbow joint. One is called the anterior ulnar recurrent. It moves backwards it moves upwards towards the elbow joint. That's why it's called recurrent artery. So anterior ulnar recurrent artery goes upwards and it moves anterior to the medial epicondyle, and it anastomoses with the inferior ulnar collateral branch of the brachial artery. So this is the anastomosis at the anterior part of the medial epicondyle, which is formed by the inferior ulnar collateral branch of brachial and the anterior ulnar recurrent branch of the ulnar artery. Then comes the anastomosis at the back of the medial epicondyle. One is the superior ulnar collateral branch of the brachial artery, which goes behind the medial epicondyle. It is joined by a branch of the ulnar artery which is called the posterior ulnar recurrent, and this posterior ulnar recurrent goes behind the medial epicondyle to join the superior ulnar collateral. So the anastomosis around medial epicondyle, one is anterior to the medial epicondyle, the other is posterior to the medial epicondyle. The one anterior to the medial epicondyle is between the inferior ulnar collateral branch of the brachial artery and the anterior ulnar recurrent branch of the ulnar artery. The one behind the medial epicondyle is formed by the superior ulnar collateral branch of brachial artery and the posterior ulnar recurrent branch of the ulnar artery. Then coming towards the lateral epicondyle, this is the lateral epicondyle of the humerus. It is formed, this anastomosis similarly is formed, one the anastomosis is formed anterior to the lateral epicondyle and one is formed behind the lateral epicondyle. The one which is forming anterior to the lateral epicondyle is formed between two arteries. One is the anterior descending branch or the radial collateral branch of the profunda brachii. I am repeating, the anterior descending is also called the radial collateral. This is the branch of the profunda brachii. This goes anterior to the lateral epicondyle of humerus. It is joined by a radial recurrent branch. This branch is the radial, I forgot to mention the name of it. So this is the radial recurrent branch of the radial artery, and it joins the anterior descending or the radial collateral branch of the profunda brachii artery anterior to the lateral epicondyle. Then moving at the back of the lateral epicondyle, two arteries join. One is the posterior descending branch or the middle collateral branch of the profunda brachii artery. It moves behind the lateral epicondyle. It is joined by an interosseous recurrent artery. So the interosseous recurrent artery and the posterior descending branch join behind the lateral epicondyle to form an anastomosis. The interosseous recurrent artery is a branch of the posterior interosseous artery. Where does this come from? The ulnar artery gives off a branch which is called the common interosseous artery. This small twig is the common interosseous artery. The common interosseous artery then divides into anterior and posterior interosseous arteries. This is the anterior interosseous artery which runs on the anterior surface of the interosseous membrane, and the other is the posterior interosseous artery which goes behind the interosseous membrane. So this posterior interosseous artery, which is a branch of common interosseous artery, which in turn is a branch of ulnar artery, gives off a branch which is called the interosseous recurrent. The interosseous recurrent artery goes behind the radius, which I have shown with the dotted line. It goes behind the radius and then emerges on its lateral side and goes behind the lateral epicondyle of humerus and joins the posterior descending or the middle collateral branch of the profunda brachii artery. So this was the anastomosis around elbow joint. I hope you have liked the lecture. If you have liked it, please press the like button.